4 new HAE treatments have been approved in the U.S. since October of 2008. HAE patients now have a choice and can work with their physicians to establish a treatment plan that best fits their individual needs and provides the opportunity to lead a normal life. First, let's consider medicines for long-term prevention, also called prophylaxis, of HAE attacks. In the past, anabolic steroids, also known as androgens, such as danazol, stanozolol, and oxandrolone, were the primary treatment available for preventing HAE attacks. While these drugs proved useful for many patients, they are associated with significant side effects, especially in women, that include weight gain, elevated cholesterol, mood changes, increased blood pressure, hair growth, and problems with the liver. Androgens do not provide immediate relief during an attack and are not suitable for children or pregnant women. The good news is that HAE patients now have another FDA-approved option for routine prophylaxis, a C1 inhibitor concentrate called Cinryze. As you know from the previous videos, HAE patients have a deficiency in the blood protein C1 inhibitor. Cinryze prevents HAE attacks by replacing the deficient C1 inhibitor protein. The medicine is administered intravenously and is approved for home or self-infusion. It's derived from human plasma, which undergoes a series of steps to eliminate viruses and has a remarkable 30-year safety record. You should talk to your doctor about the risks associated with medicines derived from human plasma. Before acute HAE treatments were available, physicians were limited to treating HAE attacks by trying to control pain and keeping the patient comfortable until the attack subsided on its own. However, patients were often treated with epinephrine, antihistamines, and corticosteroids, none of which, according to medical experts, are effective for HAE attacks. Fresh frozen plasma, or FFP, has also been used because it contains C1 inhibitor, but many HAE experts do not recommend FFP because it's been shown to actually worsen swelling attacks in some patients. There are now 3 treatments available for treating an HAE attacks once it's begun. The first FDA-approved acute attack treatment is another brand of C1 inhibitor concentrate, Berinert. Berinert also undergoes a series of virus elimination steps and has a remarkable 30-year safety record. Ecallantide, called Kalbitor, is another option for treating HAE attacks. This medicine inhibits kallikrein, which is a key enzyme involved in the process of creating bradykinin, the peptide that causes swelling and hereditary angioedema. Unlike C1 inhibitor, which is injected into a vein, Kalbitor is administered subcutaneously by 3 shots. The product must be administered in a hospital or a healthcare setting because allergic reactions were observed during the clinical trials. However, patients may opt to take this medicine at home under the supervision of a visiting nurse. The most recently approved treatment for HAE attacks is icatibant, called Firazyr, a medicine that's designed to block the impact of bradykinin, which, as noted earlier, is the peptide that causes swelling. Firazyr is available for self-administration and is delivered through 1 subcutaneous injection. Clinical trials are underway for a 5th HAE attack treatment, a recombinant C1 inhibitor that's derived from the milk of rabbits engineered to produce a human C1 inhibitor protein. Regardless of the HAE treatment that is chosen, the HAE Association recommends that every patient should work with their HAE doctor to establish an additional, separate plan to handle any HAE emergency. The parents of children with HAE should also work with their physician to put an individualized HAE treatment and emergency plan in place. There are some age limits for the FDA-approved HAE therapies now available in the U.S., and parents should discuss obtaining access to the available products with their child's treating physician. Because surgical and dental procedures can cause HAE attacks, many patients and their physicians take preventative measures by pre-treating with Cinryze, which has been FDA approved for routine prophylaxis. Your doctor may recommend treatment the night before or the morning of a procedure. HAE patients now have a choice of medicines and treatment options. The experience of countless HAE patients shows that intelligent use of the available HAE medicines can dramatically improve quality of life. Therefore, the HAE Association recommends that you work with your doctor in developing an individualized treatment plan. In addition to identifying the product that you will be using to control your HAE symptoms, your treatment plan should also reflect decisions regarding, number one, where you will receive your HAE therapy. Will it be in the home setting, or will you go to a doctor's office or an emergency room? And number two, who will be administering the medication? Will it be you, a family member, or a healthcare provider? Keep in mind that your HAE Association Patient Services representative is ready to help you sort through the issues you need to consider when working with your doctor to establish a treatment plan that fits your individual needs.